compromised individual that will become current current for 2007 reported by the World Health Organization, 2009 I guess. So they are saying that if we have a total of 6 billion people in the world, one third of that, which is 2 million, is infected with tuberculosis. So hindi pa sinabi dyan kung yung tuberculosis na yon is active or not active. Kasi yung active, yung pinaka nakakahawa, pinaka able to infect other individuals. So they're saying that in 1 in every 10, sorry, 1 in every 10 individuals, dyan sa 2 billion people na yan, may have the possibility to become sick and pwedeng makahawa ng 10 to 15 people every year per individual. Next. So signs and symptoms, pulmonary tuberculosis suspected if a person has 2 weeks or more of cough, and it may or may not have associated symptoms like fever, chest and back pain, poor appetite, weakness, weight loss, night sweats, and blood in sputum or phlegm. So, kailangan po natin i-emphasize na pag nararamdaman na yun ng pasyente, kailangan natin i-refer sa clinic or sa hospital. Okay, thanks. That's it. TB is curable naman. Although masyadong kumbaga pa masyadong nagkaroon ng TB apocalypse sa mundo, TB is curable and that's a good point about it. But we have cases because of either wrong treatment regimen na binigay or either non-compliant yung pasyente. There are cases of drug-resistant tuberculosis. So this is the resistant to TB drugs, and maybe due to improper treatment regimens, the wrong dosage, wrong time, and patient does not complete the whole course of treatment. So ito yung naging basis why we implemented the DOTS or the directly observed treatment short course. There. So next. Okay. We have 2 kinds of drug resistance. Actually, there are many kinds of drug resistance. We have mono drug resistant, but this is the most common, the multi-drug resistant and the extensively drug resistant tuberculosis. So the multi-drug resistant tuberculosis, they are resistant to our first-line drugs like rifampicin and isoniazid, and the extensively drug-resistant tuberculosis are those resistant for those 2 first-line drugs, and as well as they are resistant to second-line drugs like fluoroquinolones, and as well as those injectable TB medications they were giving like amikacin. That's it. Okay. Dahil dyan, tanungin nyo ulit yung inyong nasa left. Left na naman. Okay, sige. There. Sabihan nyo yung taong nasa left ninyo. Ito. If cuteness is a medicine, sabihin. I don't have MDR-TB. Multi-drug resistant tuberculosis yung MDR-TB po. Sige na nga. Yun. Ito na lang. Extensively drug resistant tuberculosis ka ba? Kasi you got me at first and still you got me at the second. Okay. Prevention and control. Ito po yung dapat natin gawin. Ito yung dapat natin, we have to emphasize our patients about this one as well as their families. So, always let us emphasize to our patients to always cover their mouth when they cough and sneeze. Do not spit everywhere. Kahit naman po walang sakit, nakakaano naman po yung nagsispit na everywhere. And wash hands properly and protect your family and friends from tuberculosis. So, take the correct kind and quantity of drugs and complete the treatment. So yun po yung pinakamalaking bagay dito, is to complete the treatment po. Okay, let's go into the burden of tuberculosis. So we are talking about the burden of tuberculosis globally, national, and yung local picture of the tuberculosis in the Philippines. So globally here, as we have said a while ago, the 2 billion people are infected with tuberculosis. Either or not they are active or not active. So, new TB cases, there are 9.27 billion new TB cases, in which 4.1 million of that are sputum smear positive patients, new cases, in which they're able to infect other individuals. And cases of that, 500,000 are multi-drug resistant tuberculosis. And we have deaths actually. If untreated and managed, we have deaths. 1.3 of that is from TB alone, and 456,000 of that is caused by HIV. Okay. There are 22 high burden countries for tuberculosis, in which yung Philippines po nag-rank 9 throughout the world, and second among the Western Pacific region. So if you can see, can you, okay. Yun. Those blue ones are those with high burden countries of tuberculosis. So if makikita mo dyan, South Africa, Nigeria, South America, India, China, Philippines, Indonesia, Russia. Yun po sila. Ano bang common sa kanila? They are the mostly populated areas, they're the mostly populated countries compared to the square meter of their country, and as well as kung makikita ninyo, yung tropical belt po natin, doon po common yung ating tuberculosis. So that includes the Philippines, Indonesia, India, the South America, and South Africa. Okay. Okay, this one is a window of the 2007 report, in which sinasabi nila that more than 1 million cases, 1 million new cases of tuberculosis infection is present on these countries like China and India. On the Philippines, however, we can see that there are only 100,000, but still big, 100,000 to less than 1 million new cases every year. Okay. There. The extent of the problem is that 1/3 of the global population is infected, and 8 million suffer from TB annually. 95% of the cases is in developing countries like Philippines, and those 2 million die of TB every year. 40.8% of tuberculosis cases are co-infected with HIV. Pero reminders po, na yung sa HIV po natin na tuberculosis is not caused by Mycobacterium tuberculosis. Meron siyang isang agent, which is the Mycobacterium avian complex. Yun. Okay, TB burden in the Philippines. So tapos na tayo sa global, and now let's go to the Philippines picture of tuberculosis. Yun. Throughout the high burden countries for tuberculosis infection, every year, rank 9 po yung Philippines. So, second siya in the Western Pacific region, kasi Indonesia yung first. And 6th leading cause of morbidity and mortality. And 115,000 per year new sputum smear positive cases, in which may ability na per person dyan sa sputum smear positive cases can infect 10 to 15 people every year. Okay? And 98 Filipinos die daily. Okay. TB burden in the Philippines, there. 6 billion of annual income is lost due to TB infection, due to TB morbidity. 27 billion pesos lost annually dun sa wages. Okay. 8 billion pesos in actual wages. Kaya dahil dyan, ulit, very ang pag-girlfriend pala parang TB. Bakit? Kasi nakakaubos ng pera. Ito pala, no? Ang pag-boyfriend pala parang TB din. Burden. Ang pagiging single parang TB din pala. Kasi no handshake, no kissing, pero talking pwede. Okay? So this is a picture of the National TB Prevalence Survey for in 3 years. So you have it in 1983, wala pang dots noon. And the implementation of dots in 1997 and 2007 National TB Prevalence Survey. Okay? masyado siyang malabo, but I would like to emphasize on the 6.6 and the 2.0. Kung kaya, kung gaano ka-effective yung ating DOTS strategy. Okay? From 6.6 na sputum smear positive patients, dahil po sa treatment after ilang taon ba yan? 1980-2007, naging 2.0 na lang po. In which sa 1,000 individuals, dalawa na lang po yung sputum smear positive. And on the culture positive, 8.6, dati, 8.6 every 1,000 population, naging 4.7 na lang po. Then, so, but this is the problem that we are looking straight right now because MDR-TB among new cases, dahil kahit sa implementation ng DOTS, naging significant pa rin yung pagtaas ng number, ng bilang ng ating multi-drug resistant tuberculosis. And there, multi-drug resistant tuberculosis among retreatment cases, yun, not significant pa din. Okay? So, conclusions natin, the burden of tuberculosis in the country has declined over the past 10 years due to DOTS program. And the significant decline is that 35% decline in sputum smear positive, so from 8 naging 2. 42% decline in sputum culture positive, so from 8 naging 3. 2. Okay. The rate of multi-drug resistant tuberculosis showed no significant difference from 1997. So, indicating no increase in the generation but ongoing transmission. So, NTP interventions in the past decade has lead to better control, prevention, case management, and better survival of the TB patients. Okay, this is just a slide showing you from 1993 to 2003 update, a 10-year survey for the new cases, morbidity, and mortality of tuberculosis. In which significantly, kahit po na padahan-dahan, bumababa naman po yung cases, new cases ng ating tuberculosis. Okay? So that's the goal. Paliit ng paliit po. Okay. This slide, sputum smear positive, is a picture on sino ba yung common na affected ng ating tuberculosis. So nakikita dyan that all entities from 2004 to 2008, that male is more likely vulnerable of having tuberculosis infection, either due to work or either due to environment. Okay? Yun.